Guys, this is Sarah, and today we are talking with Heather regarding craniosacral therapy. I don't know too much about craniosacral therapy outside of a conversation with a buddy of mine, so I think this is perfect to learn from somebody who is way more knowledgeable and can dive deeper into the way that it can enhance our general wellness and can also be part of um, maybe a care plan for those who experience post-concussive symptoms or have had traumatic brain injuries. Um, Heather, do you mind sharing a little bit of your background and how you got into cranial sacral therapy?
Sure, Sarah. Thank you so much. My name is Heather LeFevre, and I've been doing craniosacral therapy for 6 years. About 15 years ago, I started to develop chronic pain in my hip and my shoulder. And I was spending a lot of money on massage therapists, physical therapists, chiropractors. And so I decided to go to massage school, not because I wanted to become a therapist, but because I wanted to receive a lot of massages and thought that that would help get me out of pain. And while I was there, I experienced craniosacral therapy and I didn't understand how it works. So that got me intrigued. And the massage school that I went to in Portland, Oregon offered an introductory class as an elective, and I took that and just really fell in love with it. And essentially going to massage school is like getting a bachelor's degree in touch, and then you can go on to take different schools like structural integration, which is where Rolfing is, or lymphatic drainage, or craniosacral, and you can get certified by these different institutes that specialize in these different modalities. So it's kind of like getting a master's degree beyond. So the school that I study with is called the Upledger Institute. And John Upledger was an osteopath, a doctor of osteopathy. Osteopathy has only been around for about 160, 170 years. And Andrew Taylor Still invented it. William Garner Sutherland innovated on top of it. And then Dr. John Upledger did more innovation. And one of those innovations was that he said, you don't need to be a doctor of osteopathy in order to help people and offer this particular subset of osteopathy of manual therapy. So I have a massage therapist license, and then I'm also certified by the Upledger Institute. And I've worked with many people that have experienced different kinds of traumatic brain injuries and concussions.
I love that you brought up Upledger fairly like right off the bat because one of the things that I wanted to also ask is like, what are some things that we should look for in terms of, you know, looking into a cranial sacral therapist, especially if we're not very familiar with it.
Well, if I can just point out a nuance. So Dr. Upledger's, he coined the term, and it's craniosacral therapy. So there's another style of therapy that's cranial sacral therapy, so that it's biodynamic cranial sacral therapy. So it starts to get very confusing for the public, I would say. And the Upledger style and innovation is very much about the anatomy and physical techniques, and then it becomes a little more esoteric. Whereas my understanding and experience with biodynamic cranial sacral therapists is they start with the more esoteric and then become more functional. But that's just my experience. I have not studied with one of their schools.
That is, well, super interesting that you kind of mentioned like esoteric and functional. Do you mind kind of just explaining what you mean exactly by that?
Okay. So there are different signals that your body is putting off at any given time that the therapist can perceive with their hands. And I like to compare it to like a sommelier. They learn how to taste a wine and know what kind of wine it is, where it came from, the different notes. Oh, I'm tasting cherry or chocolate. So a manual therapist that has very sensitive skill of touch is similar in the same way of, oh, I can feel this signal or I can feel that signal. So one of those signals is your cranial rhythm, your craniosacral rhythm. And so it is confusing because we'll say cranial work with an L, but it's cranio with an O, craniosacral therapy. So it does, you'll hear kind of therapists go back and forth as well. They don't always get it perfect. But that rhythm is the 3 to 5 ounces of cerebral spinal fluid that's around your brain and your spinal cord. It's bathing it with nutrients. It is allowing the neurotransmitters to get from A to B. And it's also removing metabolic waste from the brain and the spinal cord. And that fluid is a filtration of blood that then becomes cerebral spinal fluid. And then after it is used, it goes back and it becomes blood again. So that rhythm of this 3 to 5 ounces moving through your brain, you have chambers inside of your brain. You have membranes in your brain that separate the left side and the right side. And then also what I call upstairs and downstairs. So you can see like a cross between the brain. And then if you've ever heard of meningitis, the meninges are 3 more layers around your brain and your spinal cord. And this fluid makes the head get ever so longer, like your forehead and your back of the head are coming out, and then your ears are going out. And it makes your whole body move. And if you've ever held an infant, sometimes you can see their little skull move. You mentioned to me that you've seen it on a dog. So, I mean, it's also happening on animals.
Yes.
And then if a human is lying on a massage table, on a treatment table, their shoulders, their whole body, their shoulders and their feet roll out and in. And we're talking about 8 cycles a minute. So it's pretty slow. And as we put our hands on you, that's one of the first signals that we're feeling for, because if we can't feel it on part of your body, say your left leg or one side of your head, that means that there is more restriction in that area, and it is an indication that we should work there.
Mm. And when you say restriction in that area, are you talking also like fascia or
Exactly.
okay.
Yeah.
Okay.
So that what I was talking about, what separates the left and the right side of your brain and upstairs and downstairs and wraps around your brain and your spinal cord, that is fascia. They have special names because anatomy gets very specific. And then they blend into, I brought my spine. So I have a model of a spine here. And so can you see how there are little nerve roots here that are coming out? You can imagine. So there's a nerve root that comes out of every vertebra, and your nerves are covered with a sheath. That is fascia. And then that blends into, you have fascia all over your body. Sometimes it's what makes your skin, if I pinch my skin and it snaps back, it's because there's fascia under the skin. It's more like a net around a lot of your organs. So if you've ever seen an apple or a pear that is in a net and it expands in 3 dimensions, it's kind of like that. But then it also blends into places where it's more like packing tape. It's really thick on the top of your head, under the skin, on your low back, on the bottoms of your feet. So fascia is different, but the fascia around your brain and your spinal cord and inside of your brain is more like the texture of balloon, whereas your brain is more like the texture of oatmeal or flan or sabayon, depending on where you're from, which one you can relate to. And it's like that balloon-like texture around. You have cranial nerves. So you have 13 cranial nerves that are originating in your brain and going down either into your eyes, operating your ears, your mouth. You've heard of your vagus nerve. That's cranial nerve number 10, and it goes down into your gut. So the sheath, the covering, the protective covering of all those nerves is fascia. So fascia can get sticky. It's made of elastin, which sounds like elastic because that's the part that makes it come back into shape. It's made of collagen, which we mostly hear about in beauty products, but that gives it its strength. And it's made of ground substance, which is you often hear in beauty products hyaluronic acid. So that's the liquid so it's this matrix of stretch, strength, and juiciness. And so if it loses its stretch, strength, or juiciness from misuse, disuse, injury, staying in the same, not exercising, that can create these restrictions. So that's what I mean. It's the losing of its structure. And so by either stretching it or compressing it, that can bring in new, fresh fluid and can help the fascia can reconfigure itself.
That I find this so fascinating. So
Yeah. Well, and also you can understand now why it can have so many effects on you as a person, because you might have visual issues, you might have auditory issues, because it's fascia that is sticky. It can affect your brain as the boss.
Yeah. So my brain, speaking of, is going in multiple directions. But
Okay.
it, for the sake of me saying it before I forget, but we don't have to answer in any specific order. But in terms of like the way, the tightness of our fascia and the way it affects our body even without a concussion, like how extensive can those effects be even without an injury?
So oftentimes you don't get to know why you have the issue that you have. And I don't think I've met a single person. I've worked on over 1,000 people. I've only been doing this about 6 years that has just one issue, so there's many issues. And, can you repeat your question maybe?
Yeah. And let me know if I need to rephrase it. But I guess in terms of even without an injury, how extensive can the effects be when our fascia is not at its best shape per se?
Right. So there's also emotional components. And so, I mean, for an adult that you've lived your whole life and you think you haven't had any misuse or disuse, but like the fact that our culture sits in a chair so much and we don't prioritize movement, there's almost always something going on. But there are even things going on in a newborn baby, so not, 9-10 months of gestation, and there, it can be helpful to work on that newborn baby to assist because they're basically their skulls overlap so that they can get through the birth canal, and then they come back to fully shaped. And then you probably heard they have a soft spot, and they're still developing as they go into being a toddler and then a child. So craniosacral therapy can assist in any biological process of developing, aging well, longevity. So it really is for almost every single person. The only people who cannot receive craniosacral therapy are people who have been told they cannot have a change in internal cranial pressure to the degree that they're warned to not sneeze or cough, or if they're actively having an aneurysm or a stroke, to the degree they wouldn't be in a massage therapist's office, in a craniosacral therapist's office, they would be in the hospital. So almost every single person can receive this work.
That is, I think it's really important that you mentioned, how everybody goes, like even a baby has so much going on and they're experiencing so much because even the emotional aspects that the baby goes through right away
Exactly.
is
Yes.
so
So,
easily forgotten and dismissed. Not that we're intentionally doing that for a baby. It's just it's as simple as for us adults, like picking up a piece of paper that seems like nothing until, for me at least, my fine motor skills are, you know, uh, affected. Then
exactly.
we see the nuance of how many parts of our body and brain are working to pick up that piece of paper. So now, based on what you said, when we add a concussion or a traumatic brain injury, how much more complex can that be for, or whether it's fascia specifically or, the other areas that you may be able to feel during craniosacral therapy?
So I think one thing that's important is like we live in a culture that wants to name everything, but it's like, where does fascia start and stop? It blends into other structures, and you are a whole being. We think of our liver as separate from our stomach, as separate from our fascia, is separate from our brain, but they all blend together and you're a whole being. So this is really a therapy for your whole self. And the concussion or the traumatic brain injury is manifesting symptoms for the person. And I think I mentioned this to you before, like where a doctor, that one of the things we often hear about doctors is first do no harm. That's their mantra. With a craniosacral therapist, we have two mantras. One is blend and meld. So we are trying to become so connected to the person that they can barely perceive us there. And we are just adding 5 grams is the most pressure that we usually introduce. So this small change can have a big impact. So, and 5 grams is about the weight of a US nickel. So blend and meld. And then the other mantra is treat what you find. And that goes back to these signals of we feel for these signals. We have a toolbox of techniques for different parts of the body. And most of those techniques are using the bones of the body as a handle to stretch the fascia from different directions. And the way that the body is put together, like some places in your body, have you ever experienced a drawer where you needed to push it in before you could pull it out?
Yes.
Or a window? There's
Yes.
places on the body that are like that, where it needs to be compressed first and then tractioned. So it's about learning where are these different places and how to use the different handles in a way. And then I mentioned before that the brain and the skull move like in and out. When it's a paired bone, like your arms, your upper arm bone, they externally rotate towards the outside sides of your body, lateral, and then they internally rotate towards the midline. But you have a lot of special bones in your skull. One of them is called the sphenoid. Have you heard of that one?
No.
So that's the bone that your eyes go through. Your eyeballs sit in, and you can only feel them and interact with your sphenoid from your temples.
Wait, sorry.
So that bone
kind of
really rocks
point?
forward towards. Sorry.
Sorry, can you point at which area again?
Yeah. So, can you see how there's a pink bone between the orange bone and the blue bone?
Yes.
And it's only pink here on the sides of the temples. And like the eyes go through the sphenoid. So this bone kind of looks like a butterfly when it's just separated out. And what's happening when your fluid is moving through your brain and your spinal cord, and if I put my thumbs on your temples, I can feel it rock forward towards your feet and then back towards the top of your head.
Is that
Okay.
the same area that kind of pulses when, well, the moments,
Like your temples?
at least the pink area, is that the same part that pulses?
You're feeling circulation.
Oh, I see.
You're probably
Okay.
feeling blood.
Okay.
Because you still have blood going through these spaces. And that's another aspect of this. It's kind of like when you're listening to a symphony, you can hear the whole song, but then you can use your mind to say, like, I just want to listen to the flutes, and you can focus on the flutes. Or I just want to focus on the violins, and I can just focus on the violins. So part of the skill of doing this therapy is like, okay, I don't want to listen to respiration. I don't want to feel for respiration. I don't want to feel for circulation of blood. I want to only feel the craniosacral rhythm of the cerebral spinal fluid influencing the body.
So that's kind of, if I'm understanding it correctly, that's kind of what you're listening for while you are doing craniosacral therapy.
Yes.
Okay.
And listening is not even the right word, because that is a word for your sense of hearing. It's really palpate. I'm palpating. I am feeling this movement through my hands.
I love that. Can you talk more on that?
We do not have many words for the sense of touch as we do for our other senses. So even in learning craniosacral therapy, one of the very first things you learn how to do is called listening stations, where we put our hands on specific places, the tops of the feet, underneath the heels, the tops of the thighs, the sides of the pelvis, the sides of the lower ribs, around the shoulders, and then on the side of the head, the top and the back of the head, the forehead and the back of the head, and then our thumbs on that sphenoid bone to feel it rocking back and forth. So there's just not enough words. And also I think that translates as well to a lack of respect for what a touch therapist does. We don't value it as much as we value what a doctor does. That is manifests, at least in American culture, as Americans are 5% of the US population, but we consume 25 to 40% of the world's pharmaceuticals. So we have a cultural bias to believe that pharmaceuticals, and especially surgeries, are the way to be healed by conditions, as opposed to maybe there's a manual therapy technique that could help you. They usually take longer, but in the long run, cutting through your body, people, like most doctors up until, I don't know, maybe 10 years ago, when they, like Grey's Anatomy, how they go through and they have to dissect a cadaver in medical school. Have you ever seen that in movies?
Yes.
Yes. Okay. The fascia, they would cut that away and throw it in the trash. But what they're learning now is the fascia is this connector of everything. And the parts don't work without this holistic connector. And a lot of what manual therapists are working with, like, yes, we work with the liver and the fascia around it. Like your liver is connected by ligaments into your diaphragm, the muscle that's helping you breathe,
Yeah.
And there's many different manual therapy techniques that if your body, the origination of osteopathy is a belief that if your body is in better alignment, that it will work better, that all of the systems will work better.
What a metaphor, though. For just so many things. Hey guys, so a quick intermission for this podcast. I messed up and didn't properly record the full audio, so this episode does abruptly cut off at the end. Forgive me, I am going through learning curves as I redo my whole system in the midst of my concussion. But I do hope you still find the information valuable and that it is still helpful in some way. We will get back to the episode with Heather. I am curious, when you talk about for example, the concept of feeling, or I don't know how you said it. Is it feeling for what's my
signals and
there
rhythm,
it is.
I would say. Because it's the rhythm. We're feeling for other signals. They each have a name, but they're like silly names,
But with that kind of makes me think about how, I'll use myself as an example, being neurodivergent already, and receiving sensory input at a high level all the time, and my body, first of all, tightening up because of it, but also now my concussion, what I noticed is not only was my visual impaired with binocular vision dysfunction, and the right side, or the peripherals of my right eye, though I don't know the technicalities of it, I'm curious how much of that gets worse when something else is going on with my body now, and the signals kind of get wonky, if that makes sense. And how craniosacral therapy can actually, at least in your experience, how that can help relieve some of those post-concussive symptoms, especially if you're neurodivergent.
Yeah, you've opened up a lot of doors. So Dr. Upledger specifically worked with a lot of autistic kids. And another one of his innovations was, I'm going to teach parents how to do some of these techniques to support their own children. So he had a hypothesis, and I don't think that it's been studied or fully developed, but that with autism, that the fascia tends to be tighter than on neurotypicals. And what we see is a lot of, children and adults who are, anywhere from highly sensitive person to diagnosed with high support needs autism find benefit from this kind of therapy. I also don't think we always get to know, why am I experiencing this symptom? It's not always that we get to know. And that goes back to the holism and the holistic aspect of follow the body, treat what you find. And just over time, so many different people with so many different conditions and different combinations of conditions find relief and improvement with this therapy. Now, is this therapy the be all end all? No way. If you only do manual therapy, you're only going to get so far. I also think you need to move your body. So a lot of what CranioSacral is doing, it's sending messages from the therapist's hands into you that you're perceiving. And it can be, some of them can be functional, like what I was describing. Like the sphenoid can have dysfunctions where it's a little bit too compressed into the skull, where it's a little bit tipped more towards the feet, where it's like a teeter-totter going to the side a little bit. So we have different ways of working with it. And that is the one bone that has the most ways to work with it. I have the most techniques in my toolbox for the sphenoid. So you can imagine, like if you've been hit with a ball from the side of your head, it might send your sphenoid like a typewriter to the side. And we can help it come back into alignment. And I'm talking like, again, it's not so, sometimes it is slightly visible on a person, but these are very subtle changes, but they have a profound impact on how the person feels once it has been reset.
Yeah, I, well, when you gave that example, my mind went to how I hit my head when I had my concussion. I can't remember if I shared it with you.
You didn't.
So I suddenly lost consciousness. My guess is from the high stress that I've been going through at the time that it happened, and I hit the front to right side of my forehead first on the counter, and then essentially flipped and hit the top back of my head, kind of, from what I heard, was like behind where the eyes are connected.
Okay.
And it's still tender in these areas now, a year later. But I am curious how the way a person, not to get mathematical here, but the impact, of our concussion physically, and how that can impact our body, or how the body can store it, and how that can manifest, if that makes sense.
Absolutely. So have you ever seen crash test dummies in a car hitting a wall?
Yes.
Okay.
Especially
so
with
that's
stunts.
a real clear visual of kinetic energy. And energy as a word to me is a little woo woo, you know, but energy is your ability to hear my voice travel across a room or travel through this microphone, through the computer, across the internet, you know. It is the photons of light that allow you to bounce, those photons bounce off of a word and allow you to read it on a page or a screen, or to be able to perceive a person or experience your environment. So kinetic energy is a real thing, and you experienced kinetic energy transferring from the counter through your skin, your bone, your meninges, your brain, your cranial nerves. And then again, from the back, from the occiput, through the skin, through the bone, through the fascia, through the brain. So I don't need to know that it was at a 30-degree angle or a 32-degree angle. I'm just going to listen through my hands. I'm going to palpate and feel, where do I feel signals? Now that kinetic energy, basically there's this phenomenon of what the body does is it tries to sweep it up into the smallest amount of space so that it doesn't influence the structures around it. And that sweeping it up into a smaller space, I can feel that. And I have a technique to work on it. That's one of the signals that has a weird, funky name that I almost don't even want to use it because it's a silly name. But I wasn't in the room when these things got named. Like, and also craniosacral therapy to me is a weird name because it makes people think that you're only working on the head. And like, I've worked on a person's toe for 20 minutes before, you know?
Okay, I think this is amazing. Can you share a little bit more on that too, just to kind of paint a picture of what it really means outside of working on someone's head?
Yeah, there's a documentary on YouTube called Touch it's quite interesting to see three different people go through this program that they have down in the Bahamas where you receive intensive therapy. So that means 4 or 5 therapists are working on the person at a time. And so one of the people in that documentary is Ricky Williams. So he was a football player, and he talks about all the concussions that he had and the pressure that he was experiencing in his head. But he also mentions like he just went through a divorce at that time in his life, and he's looking to make a transition. So it's like those big emotional things can have an impact on us too. And they show you 2 ways of working on people. They show it on the table, a massage table, a treatment table, that what you're most likely to ever experience cranio. But then they also work on people in the water. So the client is floating in the water, and that takes away a lot of the gravity. And then the crazy thing that happens is dolphins of their own volition swim up, and they make their little dolphin sounds, and those little sound waves travel through the body, and those can help release restrictions and help people ameliorate their symptoms and issues. So there's lots of different ways to work with people. One of the things that we do is called positional release. I might pick up your arm or pick up your leg, and I'm following the signal as I move it around, and it's telling me, okay, hold here. Okay, keep moving. Let it unwind. Follow it. Okay, hold here. I can take your head off of the edge of the table and do the same thing and let your neck move around. And then the body says, no, hold. And then move again. So I've never received the therapy in the water, but I would like to someday. That is like a pretty elite, privileged ability to be able to go to the Bahamas and be one of those people.
It sounds amazing. It makes me think of, I don't know if this is what you're referring to, but like certain frequencies helping. Is that kind of what
I guess you could consider like the dolphin sound a frequency. A frequency is just with, I associate that with sound, but I guess there's, yeah. But back to your injury, you know, we're thinking of a very direct route from frontal bone into brain, but there's all these bones in the front of your face. So you have two little nasal bones. You have an ethmoid in there that, like, I encourage you to look these up. Like, it's kind of like a walnut behind your nose. And in the roof of your mouth, you have a bone called the vomer, which is kind of like a guitar pick. And like when one of the things we do, I mentioned this to you before, we put on a medical glove and we work inside the mouth because affecting one bone influences the others. So this is a thing of like balancing all of the bones. So I put my hand across the frontal bone and I'm feeling through there to feel that sphenoid with one hand, and that sphenoid rocks towards the feet and towards the top of the head. And I stick one finger in the mouth and this finger is touching the roof of the mouth, and it's slightly different. So it's like as the sphenoid rocks forward, the vomer comes out. So it's kind of like, have you seen an Easter egg that's connected?
Yes.
That's how, you know, that's happening. When I have my two fingers on the biting surfaces of the top teeth, I'm connected to this yellow bone, the maxilla. And what the maxilla does is it slightly widens and slightly narrows. As the sphenoid rocks forward, it widens. And as the sphenoid rocks back, it narrows. So a lot of people don't know this of if you get a palate expander or you get braces, that can influence the ability of your cranial rhythm to be able to express itself fully through your skull. And then that can have like I had braces for 2 years between like the 6th and the 8th grade. How did that impact my skull development? We don't get to always know why, but you can feel it when a person with these advanced skills can feel that it's not moving great or it's not in synchrony. So that's a lot of what we're looking for, is that the bones move in synchrony. Like you've got these bones, your temporal bones on the side where your ears come out. You have one on each side. They're kind of like wheels that are rolling forward and back. And they can be out of sync, like one rolling first and then the other. So to fix that, we will hold one and wait for the other one to come back, and then they start to roll together. So there's just like I'm giving you an idea of many techniques, like the nasal bones, these two little brown bones here that are at the bridge of your nose. We work on those. They're so tiny, but it's like 2 fingers on that. It's like, does it want to go a little bit to the right? Does it prefer to go a little bit to the left? And you judge it. You take it in its direction of ease first, then the direction of barrier, and then there's more loosening. And then we also put a little like a little tripod on your forehead and try to lift it up like a hatchback. So there really truly are techniques on how do you palpate each of these bones? How does moving optimally feel like? And then what can you do to give it a little nudge to get there? Because these bones, like I told you, the nasal bones, the ethmoid, the vomer, the sphenoid, they can get smushed kind of like a shelf of books. And so we want to create space between them. And then that influences the rest of your skull. So yes, there's so much more happening in your skull, but then there's absolutely things that are happening in your gut about like your intestines, your colon, your reproductive organs, your bladder, like all of those they also have movements. They can be moving optimally or not.
Right.
So that gets a little bit more into what's called visceral manipulation. There's a whole different guy from Dr. John Upledger called Dr. Jean-Pierre Barral. He really focused first on the organs of your viscera.
Mm.
And so I'm learning that too, but you would be surprised at, like, you might have a shoulder pain and it's because your tailbone is out of whack. You know, where you feel it isn't necessarily where, and like that kinetic energy could have traveled down your spinal cord, and it might be like in your thoracic spine, and you need work there. And then these new symptoms that you're experiencing start to go away.
I so a little bit of a story that I hope I can remember to connect with what you're saying. But
Okay.
at one point, I fractured my right rib a few months after my concussion. I think maybe 6 months or so. My
Okay.
guess was, again, by that point, the stress that my body was going through, my muscles around my diaphragm were so tight that when I got sick, it just it couldn't, my muscles wouldn't release. It eventually cracked my rib, from coughing so much because of what was already happening prior to me being sick. And that kind of reminds me of how the last time we talked, you mentioned how a lot of the post-concussive symptoms you see that last were already connected to something that was happening prior. Um, do you mind kind of sharing how, you know, maybe in your experience, like how often that does happen when the time that you see clients, because we don't always know where something starts, and maybe what you end up recommending or what kind of approach you end up taking for something like that.
Sure. So, like, even with little babies, when the mother or the parent is in the room talking about the birth experience, there can be these particular signals that are being put off. And then those having that release, then the constipation goes away, or the torticollis with babies, they sometimes their head favors one side or the other, or strabismus where one eye is going in one direction and the other, they're not aligned. So little babies have certain different symptoms, and it's not that by working on the skull that it went away. It was working on that emotional component and emotional signal.